Good afternoon and welcome everybody. Thank you for joining us today. My name is Andrew Daphne and I'm the Instruction and Outreach Librarian at the New Jersey State Library. And it is my pleasure to present Cathy Forbes from the Mercer County State Health Insurance Assistance Program. Cathy has been the program coordinator for the Mercer County SHIP team since 2016 and is employed by the Children's Home Society of New Jersey. Since emigrating from the UK, Cathy has enjoyed meeting and working with the local population and aims to use her MBA in healthcare leadership to support Medicare beneficiaries, their families, and caregivers as they navigate the complexities of Medicare so that they do not overpay for their coverage. So thank you very much for Cathy to come and speak with us today. A few housekeeping items before we jump into the presentation. First, if you have any questions, you can ask them using the questions box in the GoToWebinar dashboard, or you can email me directly. My email is on the screen. You can submit your questions at any time, and if there's something that is pertinent to the topic at hand, we'll be sure to answer it. There is also a copy of the presentation in the handout section of the dashboard, so you can go ahead and just click on the file and that should download. If you are using Google Chrome, there has been reports of it not downloading correctly, and it seems to be that's a personal setting that you have in Chrome dealing with PDFs. So if that's the issue, you can either try another browser or wait for the follow-up email in which everybody will get a copy of the presentation as well. There is a survey that'll be provided at the end of this program as well as in a follow-up email. If you can please complete the survey, we greatly appreciate it. We take everything you say very seriously, and it helps us as we develop our future programming. And if you're looking for more information about the State Health Insurance Assistance Program, specifically in Mercer County, you can visit the link on the page, and I will make sure that goes out in the chat so everybody has a live version of the link. One last thing before we get started is this is what your GoToWebinar dashboard should look like. If you do not see this, look for this orange box with a white arrow either at the top left or right hand side of your screen. That will open and close the dashboard, and it's possible that the dashboard loaded closed when GoToWebinar launched. If you can't find that box, perhaps look for this blue clover type icon at the bottom of your screen in your taskbar. You should be able to click on that icon, and then that should load the dashboard as well as the video. At any point today, if you're having any issues trying to figure something out or something's not working, you can use this raise hand button here. That'll alert me that you are having some type of problem. I will get in contact with you and hopefully be able to resolve it. As I said before, there is a handout, and you can find it in the handout section here in the middle. And lastly, if you have any questions, just type them in this box here, hit the send button, that'll get sent to us, and we'll be happy to answer it for you. So that is everything that I have for you today. So it is my pleasure to turn it over to Cathy.
Okay, hello, my name is Cathy, and as Andrew kindly introduced me, I am the program coordinator for SHIP in Mercer County. I know that people may be here from anywhere over the state, so I am going to be talking about Medicare in New Jersey rather than specifically in Mercer County. However, if you have questions about Mercer County, that is the area I know best. Now, SHIP is a federally funded program that operates across the US. I have put in the state SHIP hotline. You are very welcome to contact me on my telephone number, and I will happily give you the number for another county, or if you have a question, I will do my best to answer it. But if you can't reach me, then the state SHIP hotline would also be able to connect you with your county. The program, as I said, is across the US, but it does have different names in different states. So here in New Jersey, we call it SHIP. Over in Pennsylvania, it's known as a prize. In New York, it's high cap. And rather appropriately, because it's so miserable the weather here today, down in Florida, they call it shine, where you can expect better weather. And I say to people every time I do a presentation that my favorite is Ohio, where they call it OSHIP, because that's what I feel people think when they are first going on to Medicare. But we're here to give you local, in-depth and objective advice. We don't work for any of the insurance companies. We don't sell any plans. I'm going to be honest with you about what's out there, what the costs are. Make sure that you're able to make the decision that is right for you, or if you're helping a family or friend, make sure that you know what to talk about with them as well. So just to go through the eligibility for Medicare, a lot of people think Medicare is only for people who are older, but you can become eligible for Medicare either because you have turned 65 or because you've been receiving 24 months of Social Security disability payments. So there are people on Medicare who are under 65 as well as those who are over 65. Your eligibility for Medicare through age is not related to your collection of Social Security benefits. So you can get Medicare even if you've deferred your collection of benefits. But if you are collecting Social Security benefits at the time you become eligible, you will be automatically enrolled in both Parts A and B of Medicare. So you'll see from this chart, this explains to you that you've got the automatic enrollment will happen, as say, if you are getting your retirement benefits at 65 or you've been collecting Social Security for 25 months. If you don't want to be enrolled because you have other coverage, you would have to opt out at that time. If you're not getting cash benefits at the time you become eligible, then you won't be automatically enrolled and you would have to opt in if you need it. And that initial enrollment period for opting in, as it were, would start 3 months before the month of your eligibility, the month that you turn 65, so the month of your 65th birthday, and 3 months after. So if you have coverage from elsewhere, you would be looking to use the special enrollment period. This means that if you or your spouse were working for a large employer and you continue to have employer benefits as your primary when you became eligible for Medicare, you can use that special enrollment period to enroll in Part B of Medicare at the time when those employer benefits are going to end. You get 8 months from the point at which the active employer benefits end. The general enrollment period is there for if you completely miss all your enrollments. Ideally, you want to avoid getting into that because your coverage, even if you enroll between January 1st and March 31st, coverage doesn't start until July 1st. So I just want to go through Medicare, and I'm going to talk again about those enrollments and the different rules, because each part of Medicare has monthly premiums, it has deductibles, has its own rules for cost sharing through the services, and it has, very confusingly, it has different rules for enrollment. We talk about Medicare having 4 parts, but if you have a Medicare card, you will know that it only shows parts A and B on your Medicare card. Part C is actually better known as Medicare Advantage. It was added back in 1997 as a different way of organising your Medicare. And then Part D is the drug coverage, and that wasn't added to Medicare until 2006. So you can see that Medicare has been added to bit by bit over the years, and that's why it really looks quite confusing today. I tend to prefer to look visually at the different parts of Medicare. So this slide works well for me. Part A of Medicare is considered hospital coverage. Now it comes through the Center for Medicare and Medicaid Services, so it's part of original Medicare. And it said, the reason it says it provides partial coverage is because it does not pay for all of your hospital care in full. There is an inpatient deductible, and there will be co-pays if you are an inpatient for more than 60 days. But otherwise, it would cover your hospital stay. If you had to go to rehab, it will provide partial coverage, hospice care, and also some home health care. Part B of Medicare, B for boy, that is also original Medicare. So that's what you'd see on your card. And again, it is not covering, even though you pay for your Part B premium, you still will have co-insurance, a deductible and co-insurance when you use Part B services. This would cover doctor's visits, surgery, lab tests, medical equipment, preventive exams, ambulance rides as long as they're medically necessary, and it also covers chemotherapy medications or other medications that you get infused or at a doctor's office. Part C of Medicare, as I said, we don't call it Part C now. It was C because it was Medicare choice, and it was added as an option after A and B were already there. But we would call it a Medicare Advantage plan. It does have to cover the same services that you would get through A and B, but instead of it being a co-insurance, you mostly would have a co-pay, and it can offer additional coverage. So it can offer additional coverage for things like vision, hearing, and dental, but those are sweeteners usually to the deal rather than it being necessarily a comprehensive coverage. And then Part D, the drug coverage, that is there to help with the cost of prescription drugs that are not otherwise covered by original Medicare. So that would be medications that you would pick up at the pharmacies. So when we look at Part A of Medicare, for most people, there is no monthly premium for Medicare Part A. And that's because you contributed to Medicare through your withholding taxes. If you've done that for at least 10 years or 40 quarters, or you are married to someone who had paid in for 10 years or 40 quarters, then it's premium free. If you have to pay a premium for Medicare, usually because you and your spouse's work history is only overseas, the Part A premiums are pretty hefty. So it is something to obviously think about, and I would be happy to provide those figures. But for the majority of people, there is no costs. Because there's no monthly premium, there's no late enrollment penalties. So if you don't enroll in Part A of Medicare when you first become eligible, you can enroll at any point. The one time you may wish to defer your enrollment in Part A of Medicare is if you are contributing to a health savings account. So once you get Part A of Medicare, then you cannot also be contributing to a health savings account with the tax benefits. Part A of Medicare, if you enroll after you turn 65, then it will become retroactive up to 6 months earlier. And so this is all things you need to take into account if you have a health savings account. Now, the deductible for inpatient care. So if you are admitted to hospital, then as an inpatient, then the deductible in 2021 will be $1,484. That's going up $76 from 2020 this year. Now, the reason I want to draw your attention to that is because that is a big chunk of cash that you would pay if you are admitted to hospital as an inpatient. There are situations where you may be admitted to hospital as an outpatient for observation, and you will receive a notice telling you if that has happened. And you will be billed then under Part B of Medicare. But if you are an inpatient, you have that deductible. It's also a benefit deductible, which means that if you are discharged from hospital and stay out for 60 days and are readmitted, even if it's for the same condition or the same problem, you would pay that $1,484 again. The large risk, the amount that figure could be so high, helps to explain why the insurances that help with the costs that original Medicare doesn't cover, why they are also pretty high. The good news is once you paid that $1,484, you don't have co-pays for your bed and board for the next 60 days. You do have some after that. Now, inpatient rehab, they are only covered by Part A if you have a qualifying hospital stay first. That means that you would need to stay for 3 nights as an inpatient in hospital before Part A of Medicare will pay towards your rehab stay. Also, Part A of Medicare will only cover rehab for up to 100 days, and there are co-pays for days 21 to 100, unless you are readmitted to hospital and you reset the clock, as it were. Now, during the COVID-19 pandemic, because the hospitals do not want people to be staying for longer than they need to, that requirement is being waived, but it is worth being aware of it and knowing when you're in hospital or your family or friend is in hospital, knowing if they are an inpatient or if they are being an outpatient. So Part B of Medicare that would cover these outpatient stays, or basically anything that happens out of hospital. So that's why it would cover things like your doctor's visits, it would cover physical therapy, occupational therapy, it covers ambulance, covers the durable medical equipment, like if you need a wheelchair to be able to get around outside of your home. The monthly premium for that in 2021 for most people will be $148.50. So that is going up about $4 from in 2020. If you have considered a high earner, which means that your income on your last tax return was more than $88,000 if you filed singly, or $176,000 if you filed jointly, then you will have a higher premium. However, you can appeal that using the form SSA 44 if your income, now that you're on Medicare, is going to be lower because you've had a life-changing event. So for example, if you've changed your job, you lost your spouse, it's definitely worth filling out SSA 44, explaining the difference. You may need to do it for 2 years because your tax return is basically your income from 2 years ago. But I would certainly suggest doing that if you think that you're being charged the higher premium. On the flip side, if you have a low annual income, so less than $17,466, sorry, if you're single, or $23,514 if you're married, and you have limited assets, you may be eligible for a program that pays your Part B premium. Again, that's a lot of money back in your monthly Social Security check if the state will pay that $148.50 for you. So if you are eligible, please get in touch and I can go through the eligibility criteria in a little bit more detail. I'd also say that although I've given the annual income there, if your circumstances have changed recently, then we would base it on your current income now, not on what your tax return was. The Part B deductible for 2021, it's going up $5, so it'll be $203. Once you have met that Part B deductible, that is when Medicare will then pay 80% of the Medicare approved rate for covered services. Now, the Medicare approved rate is a rate that has been assigned to every single service that is covered by Medicare. If providers accept Medicare assignment, they cannot charge any more than the Medicare approved rate. If providers do not accept Medicare assignment, but they do accept Medicare, they cannot charge any more than 15% over the Medicare approved rate. That is usually more important to ensure that you are not being overcharged by a provider who maybe doesn't normally accept Medicare but saw you, for example, in the ER and so saw a Medicare patient. They cannot just charge what they want. The maximum would be the Medicare approved amount plus 15%. The only other times that I hear that it may be applied is more in mental health, and that's probably because there is less understanding of the costs of mental health care than there is of physical health care. But on the whole, most people have told me that the providers in New Jersey do accept the Medicare approved rate. I talked about delaying Part B enrollment. The reason you would want to delay Part B enrollment is because if you do not need it, you don't want to be paying $148.50 per month for something that you're not going to be using. You may defer Part B enrollment once you're eligible for Medicare, as long as either you are still working and covered by group health benefits from a large employer, or your spouse is still working and you're covered. If your healthcare coverage is not based on working, so for example, if you're on COBRA or it's retiree coverage, or if you're covered by a small employer or have marketplace coverage, or you have no other healthcare coverage, you do need to enroll in Part B of Medicare because that would be your primary coverage. And a large employer depends on whether you're on Medicare due to age or due to disability. If you're on Medicare due to age, then a large employer would have 20 or more employees. So it's not a massive employer, and it does not have to be that every employee is taking the healthcare, the group healthcare. So, sorry, I should say, going back to that, then when you are no longer being covered through those working age benefits, that's when you would use your special enrollment period to enroll in Medicare. If you have COBRA, you may want to wait, and you're happy or the COBRA is being paid for, you may want to wait up to 8 months before enrolling in Part B of Medicare, but do not leave it any longer than that, because otherwise you would have to wait until that general enrollment period to be able to enroll, and your coverage may be delayed, and you may be subject to a late enrollment penalty. The late enrollment penalty comes in if you go more than 12 months without Medicare coverage once you become eligible. So Part C and D of Medicare, I've said several times, you don't see them on your Medicare card. They are considered optional. So Part C, as I say, we now know it really as Medicare Advantage, and generally that will include your drug coverage. And Part D is standalone Medicare drug coverage. Usually you would have either a Medicare Advantage plan or a Part D drug plan, but the New Jersey State Health Benefits Plan is the exception to that rule. Most people have an Aetna Medicare Advantage plan through the state and Optum Part D drug coverage. But if you are buying Medicare Advantage for yourself, then you will find that you cannot have both. It's an either or. And although the Medicare drug coverage is optional, you do have to have coverage that is at least as good as a basic Part D drug plan once you're eligible for Medicare. So that could be employer, union, or retiree coverage, or COBRA coverage, and your insurance company will be able to confirm if your coverage is creditable. Also, creditable drug coverage would be the drug coverage offered as part of a Medicare Advantage plan. What it would not be is if you just are using a prescription discount card, so something like GoodRx. It would not be a drug manufacturer program, and it wouldn't be a pharmacy or supermarket program. So it's just something to be aware of, because you cannot go more than 2 months once you are eligible for Medicare without having creditable drug coverage. So when you're looking at your coverage choices, you have 2 different ways in which you can organize your Medicare. The first option is to have original Medicare. So when you go to the doctor, you show your red, white, and blue card, and you can then choose to add to that prescription drug coverage, and you could also choose to add supplemental insurance. Now, that supplemental insurance may be a Medigap policy that would pay after Medicare pays, or it could be a retiree group health plan, and it's considered supplemental if it's paying after Medicare pays. The alternative option is to look at a Medicare Advantage plan, or Part C. So these plans are generally an HMO or a PPO, and typically would include your drug coverage. And you have to still have Parts A and B of Medicare. However, the bills will be going to the Medicare Advantage plan insurance company, and you would just show the one card, whether you're going to a hospital, whether you're going to the doctors, or whether you're getting prescriptions. You would have fixed co-pays or fixed co-insurance rules for the different services that you get. So I'm just going to talk about these different coverages that you can get. So Medigap plans, these are secondary insurance that pays after Medicare pays. There are 10 plans labeled A through N, although 2 of those plans have been grandfathered to people who are new to Medicare after January 1st, 2020. These each plan, the 2 plans that have been grandfathered are Plan C and Plan F, and they were the 2 plans that covered the Part B deductible. Each plan of each letter must offer the same coverage, regardless of which company you're getting it from. The only variation is the premium cost, and the premiums are based on what is being paid out in claims. So the more established companies will generally have higher premiums because there are more people enrolled in those plans who are making claims. The newer companies who are newer to the market may start off with lower monthly premiums, but they may increase more quickly once they have more people enrolled who are then making claims. So the premiums will vary. They depend on the plan letter. They depend on your age and your gender. Men, unfortunately, will be paying more for their Medigap plans generally. And they also vary between the companies. All the premiums do go up with age. So you may start at around $100 a month when you first turn 65, but it will go up with your age over time. Some of the companies do offer household discounts. So if there are two of you who are enrolling in a plan, you may want to get it from the same company. You usually get about a 7% discount. And just to be aware that the premiums don't relate to your personal claim history. It's not like car insurance. The claims are the premiums are based on the population claims being made. And as long as you pay your premiums, you cannot lose your Medigap plan, regardless of your health status. You can go to any doctor, provider, or hospital that accepts Medicare. So because Medicare is your primary, and depending on which lettered plan, it will cover some or all of your deductibles, the copays, and coinsurance. All of the plans do cover that Part A hospital deductible. The reason I made such a big deal of it being $1,484 is to give you an idea of why those premiums can be quite high. So if you had a plan that had a premium of $100 per month, you'd be looking at paying, say, $1,200 per year. That's less than one admission if you were admitted to hospital with no coverage, just your Part A and B. So the plans pay after Medicare pays, which means that they will only cover services that are approved by Medicare, and they cannot offer additional benefits and cover things that Medicare wouldn't cover, such as dental, vision, or hearing benefits. That's different to the Medicare Advantage plans. So if you have original Medicare, what you will see on your Medicare card is you will see your hospital coverage and you will see your Part B coverage. You'll see your coverage start date. And you can see that for most people, there's no premium for Part A, but you've got the monthly Part B premium. And during open enrollment, what you would need to do is review your drug coverage. If you have a Medigap plan already, you can change or review that at any time of year, but you will be subject to medical underwriting and could be turned down for a new plan. That is because if you do not have a guaranteed issue right for a Medigap plan, the plans will ask you about your health history. The medical underwriters will make a decision on whether they feel they're going to lose money on you effectively, and they may charge you more for the same plan or could turn you down. When you first enroll in Part B of Medicare, you have 6 months in which you can enroll in any Medigap plan that is on sale in your state, and you must be charged the preferred rate from whichever company you go with. There are some other set situations where you would have a guaranteed issue right, but if you don't have a guaranteed issue right, then the company would use medical underwriting. With a Medicare Advantage plan, your Medicare card will still show Part A and Part B, and you do have to have both Part A and Part B to be able to enroll in a Medicare Advantage plan, but you would also have a Medicare Advantage plan card. Now, I've just because it was available, that's why this is an AARP United Healthcare Medicare Advantage plan card example, but there are lots of different companies that offer it. The Advantage plan will set its own cost sharing rules. So instead of having that Parts A and B deductible, they will set their own deductibles and cost sharing. And that should say the maximum medical out-of-pocket in 2021 will be $7,550 for in-network care. For those plans that do allow you to go out of network, the maximum medical out-of-pocket for in and out of network together would be $10,000. Now, when you go to see a provider, although you have got Medicare and you must be enrolled in it, what the card you would be showing is the Advantage plan card. So you have to ask if your provider accepts that plan. Now, during open enrollment, during this period, you want to review your Advantage plan choice, And you can decide if you want to come out of the Advantage plan system and go back to original Medicare with a Part D drug plan. And I just want to explain, so it is very easy to go from original Medicare to a Medicare Advantage plan. You can make that change every open enrollment period, and you cannot be turned down for a Medicare Advantage plan on offer in your county. Equally, it's very easy to switch from a Medicare Advantage plan to original Medicare with a drug plan. You can do that every open enrollment period in the fall. And then there's a second opportunity during what's called the Medicare Advantage open enrollment, which runs between January 1st and March 31st. During that time, you can either switch your Advantage plan or go to an original Medicare with a drug plan. But it is difficult to switch from Medicare Advantage to original Medicare with a drug plan and a Medigap plan. Because as I said, unless you have a guaranteed issue right, purchasing a Medigap plan would be subject to medical underwriting. So you could be turned down or charged a higher price based on your health history. So if you are thinking about going from a Medicare Advantage plan to an original Medicare plan this open enrollment, I would certainly speak to the Medigap provider and go through the process to see if you would be accepted for a Medigap plan before making your final decision.
Hi, Cathy. We actually have a question on that last slide.
Of course, yes.
And it's, my mother has been enrolled in, had been enrolled in traditional Medicare, but then moved to a Medicare Advantage plan. She wants to move back to the traditional Medicare as her plan only covers medical care in the state of New Jersey. Is there a fee to transition back, and if there are any other drawbacks? I know you discussed the possibly the underwriting with the Medigap, but are there any other drawbacks?
Now that is a very specific situation. It may be if the person who's question asked if your mother enrolled in a Medicare, so she had a Medigap, right? So if she's only had it for this year, she should have what's called a trial right and should be able to return, as long as it's been within the 12 months, to return to the Medigap plan that she had. She should be able to pick that back up again. But if the person who asked that question wants to give me a call, we can go through that in more detail and just double check what the rulings would be, because then you wouldn't be subject to the medical underwriting because you've had a trial right to try a Medicare Advantage plan for the first time. But otherwise, there isn't a specific fee to pick it back up. If you didn't have the trial right, then it would just be the medical underwriting.
Okay. Yeah. Yep. The person's mother has been enrolled in the Medicare Advantage plan for many years. So.
So the difficulty there would be that the mother may not be able to get a Medigap plan. If the person who's in that situation, if you want to give me a call, I'll just check if there are any other options that we could look at, because there may be some other situations if anything else has changed for your mother's in her situation, to see if we can get an opportunity for her. So please do give me a call and I'll see what I can do. So the Part D prescription drug plans, these are plans that are offered by insurance companies contracted by Medicare, and each company has to offer at least 2 prescription drugs in each treatment class where 2 exist. The prescription drug plans cover the insulin and supplies for injecting insulin, but not the test strips. They actually come through Part B of Medicare, and most vaccines are covered by the prescription drug plans. The pneumococcal, the pneumonia vaccine, and the flu vaccine are the exceptions to that rule. So shingles vaccine does come under Part D. The cost of a Shingrix vaccine is looking like it's about $135 to $150 per dose on most of the drug plans, but we can check that. If a drug isn't on the formulary, then you have to pay the full cost of the medication. And those drugs that are on the formulary will be given a tier level. And depending on what tier will depend on how much you pay. So tiers 1 and 2 will be generic medications, tiers 3 and 4 brand names, and tier 5 the specialty medications you tend to see advertised on television. As you might expect, as you go up through those tiers, the costs do increase. Tier 6 came in later. Not all plans offer any tier 6 medications, but where they do, these are clinically effective medications that are offered at a low cost. It's really something, it's not for everything. The Part D prescription drug plan costs in 2021 in New Jersey, the range goes from $7.30 per month up to $97.70 per month. The median premium is $34.40. Generally, but not always, if you're paying a higher premium, you are more likely to have less or no deductible, but that doesn't always follow. Sometimes there are just plans that have really become, they just seem unaffordable. It doesn't make sense why they're still showing the premiums are high, but they're not offering you really many benefits. In 2021, the maximum deductible will be $445, and during the deductible period, you pay the full cost of the medication until you reach that limit. The amount does vary between plans, and for some plans, the deductible may only apply to certain tiers. So, for example, only tiers 3, 4, and 5. There are then 3 different coverage periods that you go through after you've met the deductible, or if there was no deductible. In the initial coverage period, you pay a percentage or a fixed copay for the medication as defined by the insurance. Now that period continues until there's a drug period where the total drug cost paid by you and the insurance reaches $4,130. You would then, after that, you go into the coverage gap or donut hole, at which point you pay no more than 25% of the cost of the medication. The rest of that will be paid by the drug manufacturer or Medicare. It used to be that in the donut hole, you paid the full cost of your medication, but the Affordable Care Act closed that up to just 25% of the cost of the medication. Now, some people will find that their costs go down during that period, and that's because if you were paying some of the specialty tiers, for example, you pay 49% of the cost of your medication during the initial coverage period. Obviously, then when you get into the coverage gap, you're only paying 25%, so it would go down. And then when you get out the other side of the coverage gap, and these are not the total that you are paying, because remember, it's a mixture of the cost paid by you and your insurance, but when that hits $6,550, you get through to catastrophic benefit, where you'll pay 5%, and I have to apologize, those figures are slightly low. Those are the 2020 figures. I think it's $3.90 and $9.20, but it's in that region for the copays for the rest of the year, whichever is the higher. Now, some people will never even meet their deductible. Some people will get all the way through and be in catastrophic coverage in January. It just depends on the medications that you take. There are 30 different standalone Part D prescription drug plans in offer in New Jersey for 2021. That's 2 more than last year. And the lowest premium plan is only $7.30 per month. Now, there is a drawback with that plan. It's though it says SilverScript Smart RX, it's actually offered by Aetna. The drawback is you can't use it at Walgreens. So if that was a deal breaker, you might want to look at another lower cost premium plan. And there are 4 others with monthly premiums under $17. If you don't take any medications, you would benefit from enrolling in a low premium plan. The reason being that I mentioned the late enrollment penalty. If you go a full year without creditable drug coverage, then you will be paying, when you do go to enroll in a drug plan, you would be paying an extra $4 per month on top of the premium. So you can see that going for something that's only $7.30 per month will protect you from racking up those late enrollment penalty charges. But also, if you do end up taking a medication, then you have coverage. There are 17 of those 30 plans have a $0 deductible for at least some of the tiers, and 4 plans have extra coverage in the coverage gap. That means that you could be paying less than 25% of the costs of certain drugs, but it isn't every drug. As I said, the Silver Script plans are now owned by Aetna. Now, in 2021, there is something new called the Senior Savings Model. This model means that the Part D plans cap insulin at no more than $35 per month in all the phases. I actually worked with somebody yesterday who took insulin, and I saw this. The really strange thing was that this person bypassed the deductible because the insulin payments didn't get them to the deductible, and they actually got into the coverage gap without ever meeting their deductible because of how much was being paid by the insurance company to keep the cost of the insulin down at $35. There was another plan where the maximum was $25 throughout. So that certainly is relevant for some people, and it does make the insulin costs more predictable. But because you take other medications, as a lot of people take other medications as well, you may find that the best plan for you is not one that's offering the senior savings model, and it isn't being offered by every plan in 2021. So how do you find the most cost-effective Part D drug plan? It's to use the Plan Finder tool on Medicare.gov, and that's G-O-V. You want to look for the Medicare.gov website, because if it's something that ends COM, that stands for commercial. So then you may find that certain plans are not on any tools they offer, or they may be promoting certain plans. What you do is you enter your current medications, dose and frequency, put in your preferred pharmacies. You can put mail order in if that's what you like to do, and it will basically churn out all 30 plans in order of which would offer you the lowest premium and medication cost for the year. So that means that you can have a look, see what works for you. It may be just what's the lowest. You may say, well, I don't like that company, or that one doesn't offer a national coverage, so I would only be able to fill my prescriptions in certain states. And that may help you make a decision. The other things to look out for are coverage restrictions. So check if there are quantity limits. Often these are just in line of what would be safe practice. But for some medications, it can be relevant, particularly some of the pain medications, if you take a larger amount. Prior authorization, that's pretty easy. That's just your doctor saying that you do need to have that medication, but watch out for step therapy. Step therapy would mean that you're being asked to try a lower or a less expensive medication before you'll get covered for the medication you actually want. If you don't want to have to go through that process, then that's not the right drug plan for you. Need to review your choice every year during the annual enrollment period. I can help you with this, or any SHIP counselor can help you with this. What we've been finding is that for some people, there's very little difference, maybe $20 or $30 over the whole year if they were to make a change. For other people, it's $2,000 or $3,000 if they were to make a change. So it's definitely worth reviewing for the amount of time that it takes. To save that amount over the coming year is definitely worth it. The programs, they're there to help with Part D prescription costs. These are only for New Jersey residents. And the person who had the question about their mum who might want to go from a Medicare Advantage plan, this is something that I would ask. I would want to know if your mum might be eligible for either of these state pharmaceutical assistance programs. Because that may give us an opportunity to be able to change your mum into an Advantage plan which may be ending. I don't know if there are any in the county that your mum's in. In Mercer County, there is one Medicare Advantage plan that is ending, because if you are in an Advantage plan which is terminating, you get a guaranteed issue right to be able to buy a Medigap plan. So that's where a SHIP counsellor, this is what we're here for. We're going to do our best to try and make sure that the system, you know how the system works, so that the system works for you. The two programs, both of them do not take into account your assets, only what you might be earning from your assets, which I know if you've just got your money in a savings account right now, you're not really earning much interest. but your income from all sources, and we still only have the 2020 figures right now. For the PAD program, your income would need to be below $2,367 per month if you're single, and less than $2,900 per month if you're married. And for the Senior Gold Prescription Discount Program, it would be less than $3,200 per month if you're single, and less than $3,734 per month if you're married. Those are gross figures, so it's before any deductions. If you're eligible for the PAAD program or PAD program, then the state of New Jersey would enroll you in your in a prescription drug plan and pay the premium and any late enrollment penalty. So for anyone who doesn't have a Part D drug plan, this is a question I'm always looking for. And then it caps the costs that you pay at the pharmacy to $5 for generic and $7 for brand name covered medications. The Senior Gold discount program is less generous, but it does give you an opportunity to change your coverage partway through the year if you needed to or wanted to, so it's worth knowing about. And also if you pay more than $15 for any medication at any point in the, so it basically does away with the deductible, because you would pay no more than $15 plus 50% of the remaining costs for the covered medications. There is a federal extra help program, which also helps with your Part D prescription costs. You will be automatically enrolled in that program if you're on Medicaid or if you get assistance with the Part B premiums. And all of these, not Medicaid, but the programs to help with the Part B premiums and the prescription cost programs can all be applied for through New Jersey Save. It is an online there is an online application, so you can do it by paper, but I would say during the pandemic, it is not worth doing it on paper right now. So if you can either apply online yourself, and that application will screen you for all the programs, or you can give me a call. And I am amazed that I've done a couple of applications this week online with people, and these people have both already been approved for PAAD for PAD. So it's definitely, if you think you're eligible, either apply online yourself through the New Jersey Save app, or let me know and I can take the information over the phone and do that for you, because you can get an answer really quickly, and that means that you can get help with your prescriptions really quickly. The Medicare Advantage plans also are contracted with Medicare, and they will either be an HMO plan or a PPO plan. If it's an HMO plan, that means generally that you have to stay within a network, whereas the PPO plans allow you to go out of network but may charge you more for doing so, and your doctors or the providers still have to agree to take the plan out of network. That's important because you have to get all your services and drugs through the plan. So you do need to check that you can use the providers that you want to, or be prepared to change. You may require pre-approval for more expensive services, and you may need referrals, and the co-pays and fees for the services do vary between the plans. All the claims get processed by the plan rather than Medicare, and you don't have to carry your Medicare card with you because what you'll be showing is your insurance plan card. On the flip side of benefit is that they can offer some benefits not available with original Medicare, so such as the vision, dental and hearing coverage. Most of them will offer that, and also some sort of gym membership, because the plans do want to keep you healthy. And since 2019, the plans have been able to offer even more benefits. So that could include expanded dental through dental riders or more comprehensive coverage. May also be able to cover for you the over-the-counter cards to pay to give you extra benefits, and also transportation. I would just say as a warning on transportation, the transportation coverage is usually fairly limited. It may be as little as 12 one-way visits. So if you think that, or 12 one-way trips, if you think that you have to go to and from a medical appointment, that's kind of only 6 appointments that you get coverage for. The plan summary of benefits will give you details, and we do also produce, or our state SHIP officers produce for us charts that allows you to look at all the plans in a summary. The premiums in New Jersey for 2021 go from as little as $0 per month up to $114 per month. Remember, you still have to pay your Part B premium because you have to have Parts A and B. And if you have PAD or extra help, you can get a discount of up to $35.50 on the plans with premiums, because they will pay up to $35.50 on the drug premium portion of the Advantage plan. So some plans have no medical premium. So if you're enrolled in PAD or extra help, it goes from a monthly premium down to $0. And you'd still get the help with the medication costs when you go to pick up your medications. The primary doctor copays can range from as little as $0 up to $35, and the specialist doctor copays from $5 to $50 for in-network doctors. Usually with the out of network, what you'll find is that you'll be paying a percentage of the cost, sometimes as much as 30 to 40%, sorry. But do remember that it's not just about what it costs to go and see the doctor. You would want to check, for example, the cost of an ambulance trip, which could be, they're usually around $200 to $250. And there's inpatient daily copays. On average, it's about $300 to $400 for the first 5 or 6 days. So again, remember, if you had original Medicare and no other coverage, the Part A deductible, $1,484. You multiply up $300 over 5 days, for example, and you're getting up to $1,500. So you are generally paying one way or another for your health care. If you don't go to hospital, obviously, you're not paying that. There'll be a copay for outpatient surgery. That's often around $200 to $300. There'll be copays for investigative tests and x-rays, often about $30. Mental health therapies, it's all different depending on which plan. But your maximum out of pocket on medical would be capped. So unlike in original Medicare, where there is no maximum out of pocket if you have no secondary insurance, if you have a Medicare Advantage plan, the maximum for in-network care would be that $7,550. And after that, the plan pays the rest of your medical costs. There are Medicare Advantage plans out there without drug coverage. These are generally aimed at military veterans, and they have names like Honor or Eagle to demonstrate that they are targeting veterans. And that is because veterans who have VA medical benefits, that is considered creditable drug coverage. So you don't also have to get prescription drug coverage through Medicare. But in order to use your VA drug coverage, you do have to fill your prescriptions at a VA pharmacy or facility. So just bear that in mind, that there is a slight drawback. But if you don't have drug coverage from somewhere like the VA, then you cannot have a Medicare Advantage plan and a separate prescription drug plan. And if you don't have creditable drug coverage, then you would be subject to the late enrollment penalty. So if you're thinking, well, I'll switch to a Medicare Advantage plan without drug coverage because I like what they offer, just bear in mind that at a later date, and if you wanted to add the prescription drug coverage, you would be subject to the late enrollment penalty. So when you're looking at your Medicare Advantage plan, if your card has that Medicare RX on it, that means that the plan is offering prescription drug coverage, so you know it's part of it. Have a look, and your plan should tell you whether it's a PPO or an HMO. So remember, HMO, you have to stay in network. PPO, you may be able to go out. You can go out of network, but at a higher cost. The cards will generally say the copays for your primary, for a specialist, and for the ER. But remember, there are costs of other services, so keep an eye out on that. And if the plan is an HMO, you may want to check, do you need to get referrals before you can go to see a specialist? In 2021, in New Jersey, there are 60 different Medicare Advantage plans available, and the plan availability varies by county. For example, there are 34 plans available in Mercer County, 30 of which have drug coverage. In the state, there are 6 plans in total on offer with no drug coverage, and there are both PPO and HMO plans available, and pretty much all plans offer some sort of vision, dental, and hearing coverage. Almost half of the Medicare Advantage plans on offer for 2021 have a $0 premium, and there are several plans that offer a discount on your Part B premium if you're paying it. and that discount is in the region of $40 to $60 per month. So effectively, the plans are paying you to be enrolled. If you're already enrolled in a Medicare Advantage plan, or for anyone who has family that maybe you want to look out for mail from the plan, some of the plans have premium increases. So is it still good value? Certainly up in the north, there is a new provider, which is Braven, which is part of the Horizon network. And what has happened there is that Horizon are nudging people to look at the new Braven plans, and that means that the premiums for the original Horizon plans, the premiums have gone up. So there was a plan that was $0 that has gone up to $31 per month, and that is to nudge people to the $0 plans offered by Braven. So keep an eye out. Some of the plans are changing the benefits they offer. So the co-pays may vary, the rules regarding networks may vary, they may be offering more or less additional benefits, so you do want to have a look at your mail. And also some plans are terminating in some counties. Now, if that is the case, those members get a guaranteed issue right for a Medigap plan, or they can change to another Medicare Advantage plan. But because that means that when you have a guaranteed issue right, you're not subject to medical underwriting, this can be really helpful for some people who would otherwise not be able to get a Medigap. And if you have either PAAD or Senior Gold, if you've not already used it, you get a special enrollment period and could make a change for the month of December, and that into a plan that's terminating, giving you a guaranteed issue right for 2021. Sounds convoluted, but the system is there. It's not exploiting it. It's just that's the way it works. So if you think you're in that situation, let me know and I can see. Not every county has a terminating plan though. So we do have one in Mercer County, but it's not across the board. So how do you find the most cost-effective Medicare Advantage plan? Well, the Plan Finder tool can check the cost of your medications, because remember, you have to get everything through the plan. You do that the same way as you would check drug plans, and then you can use the plan summary chart for your county to compare the cost of medical care. I don't know how every other county has laid theirs out, but I've certainly found that although mine here in Mercer goes across 5 pages, it's still very tiny writing. So I am encouraging people that if I can send it to you electronically, that's the best way, because you can look at it at a larger text size. Otherwise, you may want to have a magnifier to make sure you can read everything. Do check your doctors are in network with the plan. I've certainly come across a few people who are telling me that where their plan was accepted earlier this year, it no longer is and they need to change. But do be aware that the doctors can leave the network at any point, and you certainly want to review your plan choice during this period. And if you make a change and it's not right, you do get a second bite at the cherry in the new year. Between January 1st and March 31st, you can make one further change and change to another Advantage plan if you need to. So the final reminders, hopefully I've kept to the time. Final reminders are, if you've got original Medicare, do make sure you take advantage of your free and reduced cost Part B preventive benefits. So that includes things like the flu shot, really important to get this time of year, an annual wellness visit, and various screenings. Your Medicare New Handbook or the Medicare.gov website have a full list, and it's not just the list, but it's the frequency with which you can get those different screenings and still be covered. I've got a quick list on the next slide that will give you an idea. You want to beware of scams, so make sure you keep your Medicare number safe. Fortunately, it is no longer a Social Security number, but it is still your Medicare number, so look after it. And with the COVID-19, unfortunately, this has offered an opportunity for scammers to ask for cash for a COVID-19 test or your personal details, or they're offering free coronavirus testing in exchange for something that you wouldn't normally give up, like your Social Security number. Medicare open enrollment, we've got until midnight on December 7th. That is a hard finish, so just remember that. And remember, SHIP is here to help. We're not going to tell you what to do, but we're going to try and find what works for you. And I said you've got help in every county, or I'm happy to help. Certainly Mercer County is my area, and we have Also, all of us, I'm a paid member of staff, but all of us, every team has a huge number of volunteers that help us. They're doing this because they want to, so they are going to do their best to try and help you. This is my contact information. So the telephone number that is my direct line is also a cell phone. So if you don't want to talk to me, feel free to text me. It's also quite a handy way because I can tap a text out quite quickly, whereas returning a call I may not be able to do. So feel free to use that. Also email, and we are now, Mercer County SHIP does have its own Facebook page. Bergen County does as well if you're up that way and want theirs. But get in touch if you need any more information or help applying for those programs to help with Medicare costs, if you want help reviewing your choices, any help during this annual enrollment period, and just any other Medicare questions. If I don't know the answer, I'll try and find it out. And if it's not Medicare related, it's not my area of specialty, but I'll try and find the telephone number for someone who can help you. And there's the list of the Part B preventive benefits. It was not where I thought it was, but it is quite a long list. Make sure that you are looking after yourself and keeping healthy. And that is it from me, other than any questions. So I'll hand it back to Andrew so that he can take over the screen. Thank you.
Thank you. All right. Yes, if anybody has any questions, please submit them using the questions box, and we would be happy to answer them. Thank you for this information, very helpful, so that's good to know. We could give it a few moments in case anybody.
Of course, and I'd just like to say as well, if anybody does call me, please do leave a voicemail. I do call everybody back, but if you just call and don't leave a message, I won't know to call you back. So please do leave a message. I can't always answer the phone.
Somebody asked, when will I email the handouts? It'll be sometime next week. I will be doing a write-up of this, and so a link to the recording as well as the handouts will be sometime next week, maybe Monday, but more likely Tuesday. So somebody wants to know if you have a contact person in Monmouth County and Burlington County, or should they just email you?
Yeah, email me. If you can email, I'll email you the number right back, because I'll be honest, I would have to look it up. So if you want to just get in touch, I'll send you the number, and I'll see if I can get the name as well, so you know who you're looking for.
Yep, and I just posted your contact information in the chat. So
thank you. And you can, if you don't want to email, you can call or text, because I can reply back by text as well. That's absolutely fine.
do you have any information on the plans from Burlington County?
So again, if that person wants to get in touch with me, I can provide the information on the Medicare Advantage plans in Burlington as well. That's not a problem. It may be on Monday, I'll just be honest, because I'm not working this afternoon, but I will get back to you.
Right. What age should you actually start to apply for Medicare?
So if you want your Medicare to begin at age 65, then you would want to start the application basically 2 to 3 months before the month of your 65th birthday. If you want your Medicare to start later than that because you have employer coverage based on active employment, then you can wait until the time when you want it to start. And again, if you know when you plan to retire, then 2 to 3 months beforehand. If it happens suddenly, you lose your job suddenly, then just get in touch with Social Security as soon as you know that you're no longer going to be working.
Thanks, you are a wealth of information.
It's just nice to have people listen to me. No, I'm just joking.
We can give it a few minutes and see if there are any other questions. All right, well, I think that'll wrap it up. Thank you so much, Cathy, for presenting today. Thank you, everybody, for attending. As I said, be on the lookout for my email. It'll have all the links and the handouts. So again, everybody be safe, be well, and hopefully we will see you at another one of our programs. Thank you.